Pivoting back to the coronavirus, hospital beds across the country are becoming scarce as ICUs attempt to deal with the surge of coronavirus cases following Thanksgiving. More than 100,000 people are reported to be in hospitals due to COVID, another all-time high since the pandemic started in March. In states like Texas, hospitals are reporting over 90% capacity, leaving some health officials to fear the worst is yet to come. Dr. Fauci is now urging the U.S. to overcome COVID denial and pull together in order to fight the virus. So we want to bring in Justin Gill for more on this. Justin is an urgent care nurse practitioner at Providence Health and Services, and he's also the chair of the Legislative and Health Policy for the Washington State Nurses Association and a health policy lecturer at the University of Washington Bothell. Thank you so much for joining us, because you are in a position where you're seeing people who are, I presume, you can correct me if I'm wrong, who are starting to see symptoms. They're coming to the clinic and they're wondering if, maybe they let their guard down and possibly they've been exposed to the coronavirus. So the first question that I have is, what are you seeing on the front lines? When you talk to people who are coming in sick, can you get a sense of why we still don't have a handle on this thing?
Yes, and thank you for having me. I would have to say that you're spot on the type of patients that I deal with on a day-to-day basis. I work with a group of amazing physicians and nurse practitioners and physician assistants, as well as support staff. And our walk-in clinics really do kind of serve as that first line of defense in screening for COVID, testing for COVID, and also counseling patients. We also have to deal with moving guidelines on a week-to-week basis that come from our state and local health departments. And part of the difficulty is essentially kind of getting through that misinformation that oftentimes goes along with COVID-19 news. Some individuals don't necessarily believe in the virus and the fact that it's a pandemic. Other individuals may kind of look at mask wearing as something that's not necessarily essential, and still have get-togethers and big family events. I usually tell patients the biggest decision and the most difficult ones, like the ones about having an event at home or a family get-together, those are oftentimes the most impactful. It's easy to go to a supermarket and wear a mask to prevent transmission to others, but it's hard to tell your own family members that you want to stay away. But that's what the current time really demands of all of us. We are working in the clinic, we're working on the front lines, and we continue to try and have the backs of the patients that come in, regardless of their background or their location or their socioeconomic class. But at the same time, we're really going to require them to have our back as well, because really we have all the control when it comes to this pandemic and the trajectory of it.
Man, I really think it was like point for point the issues that I think many people are struggling with. A lot of people decided not to visit family members for Thanksgiving. A lot of people did, but a lot of people didn't. But now we're heading into Christmas and Hanukkah, and I'm hearing people in my own neighborhood talk about visiting their elderly grandparents for Hanukkah or for Christmas. And when you talk about the shifting restrictions, I totally get it. Where I live, none of the children have been in school for the entire year. But where my child goes to school, which is a 20-minute drive away, they have been in class. And I think people are confused by, what seems like to them sort of arbitrary restrictions. But now the FDA approved the safety of the Pfizer vaccine, or is about to approve the safety of the Pfizer vaccine. Vice President Mike Pence says that the distribution will be starting soon. But what are you expecting once the distribution starts? What do you think the challenges are going to be?
Well, it is going to be very challenging. And part of it is that this is new vaccine technology, mRNA vaccine. As you know, it has to be transported safely, and there's some specifics around how you actually transport it at the right temperature. The other piece about that is the fact that there may be limited doses available. So who is it that necessarily would get the vaccine first? Often our state here locally, Washington State, has released some information related to a phased approach at releasing the vaccine. But, when we're trying to implement something very quickly like this, there are going to be some hiccups. I'm reassured by the fact that there are maybe other vaccines that are coming shortly after that of Pfizer. Moderna is an example of one. But again, it's really going to require our local and our state governments, as well as our federal government, coordinating on this. The same kind of approach needs to be taken with testing. It needs to be taken with public health guidelines, as well as the distribution of aid and resources. I'm optimistic about the vaccine. I think that there's some good news that continues to come out, but we need to remain cautious, let the science play out, and follow that science so that we can have trust in whatever vaccine comes out.
So, in January, we're going to have a new administration. The president-elect, Joe Biden, has released a 3-point plan to combat COVID. Once he takes office, he says, 100 million people are going to be vaccinated in the first 100 days. I think there's still a conversation about whether or not that actually will happen. But, he wants a mask mandate as much as the federal government can do that. And he wants to see kids going back to school. I want to ask you, what you make of this plan, and is he saying all the right things, or would you like to see maybe an emphasis in other areas? What's your take on it?
I think he is saying the right thing, to be honest with you, and I say that as a objective observer of individuals following science and not necessarily letting any political ideology or philosophy kind of guide the decision making. Mask wearing, as we know, is extremely important, and it can be one of the most effective, cost-efficient tools that we have. But when we have an administration coming in that is truly focused on what is the problem, how do we address it, and how do we use science and data to help guide our decision making, that's what is most important. In order to address a global pandemic like COVID-19, we need to address it the same way healthcare providers and scientists address it at the bedside and on the front line. We look at the problem, we look at the facts, and we make objective decisions to improve the outcomes of patients. That same philosophy and approach needs to be taken by whatever administration comes next. And the Biden-Harris administration, I think, is making some good steps as far as including frontline healthcare workers. A nurse from my own community, Jane Hopkins, was added to the COVID task force, which is a reassuring step, because there's also the guidelines and the information that comes from the larger organizations, but there's also the coordination with local public health officials and frontline care providers so that they understand those guidelines and they can implement it effectively. So I'm reassured by President-elect Biden's statements. I'm looking forward to seeing how he is able to bring in people that will be able to make a big impact on the pandemic. And as I said before, I'm optimistic moving forward.